Well, as you might imagine, virtual doctor visits have increased dramatically since the pandemic began.
What wasn't expected is just how much they've changed the healthcare landscape. At Allina Health, they were doing 20 to 30 virtual visits a day 2 months ago. Now they're helping about 5,000 patients a day through virtual care. John Lauritsen explains why that might continue even after the pandemic is over.
I'll admit to going in somewhat skeptical about how can a surgeon help virtually?
When Katie Mauer's 81-year-old mother was having nerve pain, she wanted to get her help without going into a healthcare facility. So instead of doing something in person, they went online.
I was pleasantly surprised at how well it went and the results that we got from it.
To be honest, it's changed dramatically, as you might imagine.
Dr. Dave Ingham keeps an eye on the digital health landscape for Allina. They've watched their virtual world change from pre-COVID to COVID.
99% of our mental health visits are being performed through virtual means.
And more than 60% of their visits overall are now done by video or over the phone, a percentage that will continue to increase.
But we can have a visit just like this and really still connect on a fairly good level with those patients.
Dr. Ingham says the visits work especially well for patients with pre-existing conditions who are afraid to go to the doctor. For example, he says most diabetics can stay home and still get help through their blood sugar readings.
And if you can communicate that to me, I can send a new prescription to the pharmacy. I can just instruct you over the video to say increase the dose or decrease it depending on how things are going.
But there are still cases where a virtual visit needs to turn into a doctor visit. Allina is seeing fewer heart attack and stroke patients, and there's concern some are afraid to go in until it's too late. They want patients of all kinds to know they're still open for business.
I definitely want to encourage folks, if you think you need care, you need to be seen in clinic. It's certainly safe to come in. Same goes for our ERs and urgent cares.
John Lauritsen, WCCO 4 News.
Dr. Ingham told John many hospitals are able to safely separate patients with respiratory conditions from patients with non-respiratory conditions. Stay with WCCO for continuing coverage of the COVID-19 outbreak.